You're watching CTOM TV. Knowledge is power.
We're starting a two program process where we're going to look at four main elements to do with self-care, things that you have mostly complete control over, that really make a difference to how your cancer care goes.
Yes.
And today we're going to do 10 to 15 minutes each on exercise and vaccines. Go.
Is the clock ticking?
The clock is
Okay.
ticking.
So HPV vaccine,
Okay.
most important thing.
All right.
There's a lot of misinformation. We did a video on the HPV, I believe, on the Cancer Guy site.
Yeah, the cancerguy.com on YouTube.
So much of that is, still relevant.
Yes, it was just a few months ago, so one would hope so.
Just a summary, HPV affects stem cells that are in a certain layer of the skin, but it only affects those stem cells when they're exposed. So in other words, they're normally covered up. So when these cells get exposed at certain key times, it can happen for a variety of reasons. And during that exposure, these HPV viruses that may be dormant or, in your body will target those cells in that layer. The classic example, obviously, is that, the parabasal cells or the basal cells in the transformation zone of the cervix. It's the epidermis. So these are, undifferentiated stem cells. They occur right around puberty. And, the puberty and pregnancy and, oral contraceptives basically leave these cells exposed. So they have a covering, the covering gets kind of stripped off or they get moved around as a very, very basic generalized mechanism. The bottom line is they're normally not exposed. And then during pregnancy, puberty, while you're on birth control, these cells get exposed. So I had a question the other day, and a patient was asking, or a person was asking about HPV and should they get the shot even though they already have tested positive. And I said, yes. I said, every man, woman, and children should get the shot. And the reason, a lot of doctors are providing misinformation about this. And it's very frustrating because these doctors clearly have no concept of, how these viruses work and what the mechanism is involved here. And it's not their fault. These are the guidelines being given by, Health Canada or, United States and so on. One thing that we do know is that you can be infected with multiple strains of HPV. So just because you have resistance against, one strain of a carcinogenic form of HPV does not mean you will not get reinfected with a different form that you may not have resistance from. It really depends on, your immune system is going to protect you against one strain at a time. And it's going to be doing it after you've been infected.
Okay.
So the damage is done.
And the vaccine covers a
variety of different ones. So even if you are HPV positive, get the vaccine anyways. It will protect you against other strains of it.
Okay.
The other thing is that this protection, this immune-based protection that you get from exposure can change. These viruses can change over time, and you can lose the protection. And also, there's many areas of the body, like the tonsils and so on. If you're someone who has, if, for example, you could have this HPV cells dormant in your tonsils, but they can't access the stem cells in the basal layer. And then all of a sudden, you get a bad cold or something like that, or you have a heavy night of binge drinking, or, something happens to your throat and removes this protective, layer. Then all of a sudden these HPV cells will have exposure to that, and you'll get one of the head or neck cancers, which are deadly diseases. Right. HPV based, head and neck cancers are very deadly.
Okay.
So it's just best to get an HPV shot and
Okay.
get as much coverage as you can get. We're constantly improving it and getting coverage of more of the different cancer-causing strains, the oncolytic viral strains. So very important. And the mechanism happens all over the body. Just because you've been exposed to it, or you may haven't been exposed to it, don't take a chance. Get it. It's a simple vaccine. It's not going to hurt you any other way.
Okay. Got it.
The other one, obviously, is the hepatitis vaccines. You want to take those. They're 95% effective against hepatitis B. So you definitely want to get those.
That's good.
And then there's some off mechanism vaccines that are very important. Flu shot being one of them. There's a lot of misinformation. You hear people talking about the flu shot saying, oh, I got the flu shot, I still got sick. Well, the flu shot is basically designed against the common strains that are being released this year from the jungle. So we have these flu fighters, and they will travel around to different areas of the globe during the tropical season, because what happens is the forests get flooded and these viruses get released from deep in the forest and they start looking for new hosts. And so what they do is they go out and they find what strains are killing people. And then they will look at those strains and they'll say, okay, this is going to be the Johannesburg, or, the Australian one. There's so many different strains.
The point is they look for the most deadly.
They look for the strains, and then they create the ones that are killing people, and then they create the vaccine for that right away, and then we get the vaccine. It can be a bit of a hit and miss. Maybe that deadly strain won't come to us. Maybe another strain will come to us that isn't deadly and make everyone sick. Maybe another deadly strain will come to us, but really it's protection, and it's being used for a reason. Using the flu shot greatly cuts down your death. And if you have cancer, your immune system is going to be suppressed. There's a really good chance you're going to, have a huge, huge consequence to this. Also, flu vaccine or flu viruses insert their DNA into our genome. And we don't know what that's going to do. It's pretty much a random insertion process. As you know, all viruses need our cellular machinery to copy themselves. And that's why they're not considered a life form. They can't reproduce by themselves. They can't copy themselves by themselves. They need an external life source to live in, so they're parasitic. And we don't know how these integration of their DNA into our genome is going to affect us. It may cause cancer. So just the mere fact of infection is a problem.
Right.
So flu vaccine, very important every year. And then there's another class of vaccines that are very important too that you can get, called the Prevnar 13 and 23. And so these are against a bunch of different deadly bacteria that can form pneumococcal infections, encephalitis. There's a bunch of different strains. And most of the strains they targeted are known as the treatment-resistant strains, the bacterial-resistant strains. And that's what these vaccines were, designed for, is to prevent people from catching these strains, because they're not treatable once you get them.
Wow. And there's just way too many cases of people who are, they're getting their cancer treatment. They've done everything right. And then they get pneumonia.
Exactly. And they die from the pneumonia, not the cancer.
That's right.
This is one of the most common things that we see.
And that's what these two vaccines, it's the Prevnar 13 and the other is called the Pneumovax 23.
Yeah, the name has changed a few times. Just ask for Prevnar 13 and 23. Pneumovax.
I'm just saying.
You get them in order. I believe it's 23 first and then 14.
13. Okay. Ask your pharmacist.
Ask your pharmacist.
The point is they are available, and they cover 13 and 23 different possible strains
that can kill you.
Especially if you have a compromised immune system.
Yeah, exactly. There's no reason to not get these things. It's just free immunity. So I'd like to wrap that up on vaccines. Definitely get your vaccines. Very important.
HPV, hepatitis, flu shot, Prevnar, and Pneumovax. Got it. Okay.
So exercise.
Exercise.
Exercise has been huge in this decade for cancer treatment. I mean, we all know. I mean, if you you know, if you live in this decade and you don't understand how a lack of exercise affects you, I mean, it's now considered as bad as smoking. Not exercising is considered as dangerous as smoking on all different health parameters. In cancer, we first started seeing it in preclinical studies, and it was probably found by accident, where they found that, you know, some of the mice, they had what was called the wheel run studies. There's a series of different studies where these mice, as you know, mice are used as the preclinical investigative vehicle for any sort of cancer research, drugs, anything. And so they had these wheel run studies where the mice would run in this wheel while they're going through their cancer treatment. And most of these studies found like between a 30 and 70% reduction in tumor growth in the mice that ran in the wheel compared to the ones that didn't. So that really led to some, you know, interesting research. Now we know the mechanisms, and there's so many different mechanisms. You know, as we've discussed before, the angiogenesis. Angiogenesis is the tumor-directed recruitment of blood vessel supply. Because tumors are so metabolic, they require a lot of blood and resources, and they're constantly growing, and so they need to get rid of their poisons. You know, they're the garbage, and angiogenesis is the process that they do it. And so also angiogenesis is unique to tumors because it's a process that mimics the actual formation of blood vessels, which is called neogenesis, but it misses the last step or two. And the last step or two is actually sealing off of the blood vessels so they don't leak. So cancer cells produce leaky blood vessels, which can lead to, you know, all kinds of problems, you know, strokes and so on. So what we know is that when you exercise, your body is going to be going through the process of neogenesis. It's going to be requiring blood vessel formation for new muscle. And the same resources, the stem cells and the different proteins and resources that are being used to create angiogenesis are also being used to create blood vessels for healthy cells. So you're stealing resources from the cancer cells when you exercise. There's the movement of lymphatic fluid. You know, that's a very important process. Lymphatic fluid moves very slowly, and cancer cells can live in the lymphatic system. And you don't want them sitting there not doing anything. You want them moving around so they have contact with the immune system. The immune system moves around the lymphatic system, and exercise is the one way to increase flow of lymphatic fluid. There's also some, you know, and there's a lot of research here. I won't even get into which ones, but there's so many different proteins and enzymes released by working muscles that have a function in inhibiting the metabolism processes that tumors use, and also are just basically tumor suppressor proteins. So these are released by working muscles. And, you know, there's another process. I like to call the creation of muscle as a metabolic inhibitor. So in other words, anything that a cancer cell is trying to do, a growing muscle is also trying to do. And so they compete for resources. They're constantly fighting against each other, but the muscle wins. If you're not exercising and not building muscle, you're feeding cancer cells. And so you want to do that. And, you know, we know that this is true because there's a condition that happens in late stage of people with cancer called cachexia. And that basically is the wasting away of someone with cancer. And that's because the cancer cells are winning and taking the resources that that person would normally be used. So they're stealing the resources that the body normally uses to make muscles. So there's that competition going on. And so by exercising, you're creating a metabolic inhibition. So I could go over studies forever.
There are lots.
There are lots.
Okay.
I would like to just briefly address one study that I did look into. I wanted something recent. So there is something called the SWOG. I'll have to look at my notes here. the SWOG 80405 study, and it was a colon cancer phase 3 trial. And what they did with these patients is they did a questionnaire, and they looked at the, a fairly detailed questionnaire. It's a retrospective study, which is not the best. It's not like an interventional study, but they wanted to see, these people were getting systemic therapy. So they wanted to see specifically how patients would benefit to exercise, even with basic systemic chemotherapy. So what they found out was that the progression-free survival, that means when 50% of those patients had disease recurrence in the study, was almost 20% longer in patients who engaged in exercise for 18 or more hours per week, when they compared that to patients who only exercised 3 or less hours per week. And so that resulted in the hazard ratio, a reduction of death of 0.83. So that what you do with a hazard ratio is you take the number and you minus it from 1, and you get the increase or the reduction. In this case, a hazard ratio is a reduction. And so if you minus 0.83 from 1, you get obviously 17.
Mm-hmm.
So a 17% reduction in death from the patients that in this study that exercised 18 hours or more a week.
2.5 hours a day.
Yeah.
It's a lot of exercise.
It is, yeah.
I mean, I do appreciate
Now, some of that was walking.
Okay.
It wasn't rigorous exercise. It was, movement.
Mm-hmm. Okay.
So I think that really outlines, the benefits. So a 20% increase in progression-free survival in this study. I mean, that's what a drug would do.
Mm-hmm.
So we're seeing benefits that are better than the actual treatments, just with physical intervention in cancers.
Right. And there are certain types of exercise that are going to benefit you more. You were
Yeah,
talking about
muscle building.
I was going to say,
Yeah.
you were just mentioning about how you really want to kind of create competition for your muscles.
Mm-hmm.
Mm-hmm. Okay. Was there more?
That's it. I mean, I could go on, but we're definitely running out of time.
I've got so many notes here.
Where do you start?
Yeah.
So get your exercise, especially if you're going through cancer treatment.
Yeah, that's right. And weight bearing especially, or the kind that's going to actually build muscle.
Mm-hmm.
Well, you definitely want the cardio because you want the lymphatic fluid moving, because that helps stop cancer from growing. But you definitely want to be building muscle is what we're hearing.
Yes.
Thank you for watching Cetome TV. Subscribe below and stay informed.